going to be doing the Apgar scale today on our newborn here. Sorry, positioning, I'm trying to use my phone for the angle so everyone gets a better idea of what's going on. So the Apgar scale is done 1 minute and then 5 minutes after a baby's born, so just to see how they're going outside of the mother's utero. So to begin with, we're going to be looking at A for Apgar, the appearance. So we're going to be looking to see whether their all over colour is either like grey or pink or blue. So look in particular at their hands and their feet, seeing whether they're pink or blue or grey. But as we can see here, and checking for temperature as well will be a good indicator. Our client here is nice and pink, so we get a score of 2. So each section, APGAR gets a score of 2 with a possible of 10 points. So we have good colour in our hands and feet, so that's an Apgar score of 2 for that part. Then we're going to be doing the pulse. So a good way to get the pulse is where the umbilical cord will be. If you have your finger there, that will be a good way to get the pulse. We can go to normal places, but here's probably the biggest part where the artery goes into, so we can feel for a pulse there. So we're looking for 100 beats per minute. So we're going to listen to that and see whether we can get 100 beats there. So if we get 100 beats, that's 2 points again, because that's the best we can get. Less than 100 sort of around the 1 point, and then none at all is 0. So we're looking for that. So that's the part for the P. Then we're going to go for grimace. So we're going to look at the way the patient like cries and moves around. So we're going to see whether they move to stimulation. So you can touch their fingers, see if they move. The bottom of their feet, if you tap that, they should be able to move there. And just stimulation with like when we dry them to see whether they move a little bit. So if we do that, if they move, they have good facial movements, that's 2. If they sort of do a little bit but not really, that's 1. But if they have nothing at all, that's 0. So nothing at all is 0, a little bit's 1, and then everything's 2, which is good. So our client here is moving around, so that's another 2 points. Then we're going to go to activity, so muscle tone. So we're seeing the way that they spontaneously move, whether they're doing normal movements or whether they're not moving at all. So if they're reflexing their legs and arms, moving around like a normal body, that would be 2 points. A little bit's 1 point, and nothing at all, they're floppy, not moving at all, that's 0. So our patient here is getting another 2. And our last one is respiration rate. So we're going to be counting their respirate to make sure they're still breathing okay, considering they've got all that fluid in their lungs. So we're going to watch the patient, make sure they're breathing. They need I think it's around 60, so we're going to make sure that they're going to be breathing. Going to make sure they're crying, so that indicates they're getting breath into their lungs, or if they're gurgling, that might be a score of 1 or 0. So absent breathing at all, 0, a little bit's 1, and then normal breathing at the normal rate is 2. So overall, points of 0 to 3 are critical. We need to do some interventions there. 3 to 6 is considered below normal, so we might need to do a few things just to stimulate them more, like rubbing them with a towel or getting them a bit warmer. And then anything over 7 is considered normal. So our little patient here got a score of 10, which means they're completely normal, no interventions need to be done.